everybody, today we will discuss about Ovarian Hyperstimulation Syndrome or OHSS. First definition. It is an iatrogenic and a dreadful complication of controlled ovarian stimulation during assisted reproductive technology. It occurs as an exaggerated response to exogenous gene and rarely to ovulation inducing agents. It is a self-limiting disorder characterized by various clinical manifestations due to increased capillary permeability and accumulation of fluid in the third space. It can have a downhill course and prove to be fatal if not timely recognized and intervened. Now, incidence of OHSS. Moderate to severe OHSS occurs in approximately 3.1 to 8% of cycles. Mild OHSS occurs much more commonly, that is in 20 to 30% of cycles. Risk factors of ovarian hyperstimulation syndrome. First, primary risk factors. Patient characteristics or factors present before stimulation and likely to amplify the response to ovarian stimulation are primary risk factors. Now, primary risk factors are: first, young age, low BMI; second, a history of elevated response to gonadotropins; third, previous OHSS; fourth, PCOS and high AMH, that is more than 3.4 nanogram per ml. Now, secondary risk factors. They are the ones which are obvious during the course of stimulation. Now, the secondary risk factors are: first, absolute levels or rate of increase of serum estradiol, that is more than 3500 picogram per ml. Second, follicular size or number, antral follicular count more than 24. Third, number of oocytes collected, that is more than 24. Fourth, development of more than 25 follicles. Now, the etiopathogenesis of OHSS. Here, the culprit molecule of this initiation is HCG. The HCG or human chorionic gonadotropin acts on hyperstimulated ovaries with multiple follicular development, which leads to increased production of vascular endothelial growth factors, and that causes capillary permeability. This in turn causes first, tissue edema leading to ascites, hydrothorax, compartment syndrome, and second, hypovolemia leading to decreased organ perfusion, liver and renal impairment, hypovolemia leading to hemoconcentration and thromboembolism. Now, the clinical features of OHSS. In mild cases, the clinical features are abdominal distension, discomfort, mild nausea, vomiting, dyspnea, diarrhea, and enlarged ovaries. In moderate cases, mild features plus pain, nausea, and ascites on USG. In severe cases, mild to moderate features plus clinical evidence of ascites, hydrothorax, oliguria or anuria, intractable nausea and vomiting. Now, in critical cases, the clinical features are low BP, pleural or pericardial effusion, rapid weight gain, syncope and severe abdominal pain, venous thrombosis, oliguria or anuria, ARDS, sepsis, arrhythmia, massive hydrothorax, acute renal failure, and arterial thrombosis. Now, management of OHSS. Outpatient management of ovarian hyperstimulation syndrome. For mild and many moderate OHSS, baseline history, examination, and investigation to be done. Encouraged to drink to thirst rather than to excess. Fluid intake of at least 1 liter is advised. For pain relief, analgesia with paracetamol. Avoid NSAIDs. Avoid strenuous activity and sexual intercourse for fear of injury or torsion of ovaries. Continue progesterone luteal support but no HCG support. Review every 2 to 3 days is likely to be adequate. Baseline laboratory investigations should be repeated if the severity of OHSS is thought to be worsening. Urgent clinical review is necessary in the following conditions. First, increased abdominal distension and pain. Second, shortness of breath. Third, tachycardia and hypotension. Fourth, reduced urine output. Fifth, weight gain and increased abdominal girth. And sixth, increased HCT. Now, inpatient management of OHSS. Indications of admission of women who first are unable to achieve satisfactory pain control. Second, are unable to maintain adequate fluid intake due to nausea. Third, show signs of worsening OHSS despite outpatient intervention. Fourth, are unable to attend for regular outpatient follow-up. And fifth, have severe or critical OHSS. Thank you for listening. Thank you.